So friends, in today's video we see pharmacology new topic. This one is a pharmacodynamics. You all are know about pharmacokinetics and pharmacodynamics. Kinetics means ADME like energy, movement, and dynamics means power. So friends, it's today's topic. Gpat Sniper 100 days hard challenge. New topic pharmacodynamics. Pharmaco plus dynamics. Okay, so pharmacodynamics. Let's see. In pharmacodynamics, we see how drug act on body. Its drugs action on body. So like that. So first one is a dynamic Greek word. It's called power. What the drug does to the body. Pharmacodynamics means how drug does to the body, means its action, its mechanism, its side effects, its adverse effect, its reaction, like that. And pharmacokinetics means its drugs, how body treats the drugs, what body does to the drug. Okay, and in dynamics, what the drug does to the body. First one, mechanism of drug action. Like we say, dynamics means drug action on body. First one is a mechanism of drug action. Mechanism means how drug act on body. First one is a physical action. By physically changing in a drug changes some physical effect on body. Acronym ROAR means radioactivity, osmotic mannitol, adsorptive charcoal. In a poisoning treatment, we use a charcoal. Osmotic in diuretic treatments, it's a diuretic drug, mannitol, and radio opacity. These are the physical action. Means drug change physical action of body and perform its action. Second, physical action. Let's see here. Mass of the drug means bulk laxative. Example brand. Protectives dimethicone. Second action, adsorptive property, in which drug charcoal and kaolin. Next, osmotic diuretic means absorb water like osmotic. Example, magnesium sulfate and mannitol. Second action, radioactivity, drug iodine 131 radioisotopes and other radioisotopes. Second action, radio opacity, drug contrast media of barium sulfate and urographene. These are the physical actions of drug. Means here is some physical action and drugs acting on by this physical action. Second, chemical action, in which drug changes chemical structure, chemical action, and produce its action on body, meets its uses. First one, drugs, antacids, aluminum hydroxide and other antacids. How its action, antacids action. Antacids means anta means opposed to acids or inhibit acids, like action, how chemical action of these drugs. Neutralize gastric hydrochloric acid. So means antacids, how would antacids works, its mechanism, they neutralize the gastric acids and perform normal action. Second, acidifying agents, ammonium chloride action, its chemical action, react with buffers in plasma and produce its action. Second, alkalizing agent, sodium bicarbonate, chemical action, alter pH of urine. Second chemical action, oxidizing potassium permanganate or iodine. How its action, chemical action, germicidal and inactivate ingested alkaloids. Second drugs, chelating agents like calcium EDTA, ethylene diamine tetraacetic acid like BAL, British anti-Levisites. Sometimes this long form ask in question, what is the long form of BAL, EDTA, like that. And next chelating agent is a penicillamine. Means these drugs form chelate with like other drugs and produce its action. Chemical action, sequester toxic metals. So friends, these are the chemical actions of drugs. Second, enzymes stimulation, drug and stimulated enzyme. Which drug stimulate which enzyme? First one is a adrenaline drug, stimulate adenylyl cyclase. Pyridoxine, stimulated enzyme decarboxylase. These are the two drugs, adrenaline or pyridoxine. Sometimes pyridoxine means vitamin B6. Okay. Second, inhibition means there is enzyme inhibition. One enzyme, one drug inhibits some enzyme and produces action, like that. Non-specific means not specific for a particular enzyme. Many chemicals and drugs are capable of denaturating proteins. They can alter the tertiary structure of the enzyme and inhibit it. Means some drugs, what they act, they denaturate proteins and produce its action. How? How they produce its action? They change or alter the tertiary structure of the enzyme and inhibit it. Okay, these are the drugs action. Second, specific action means some drugs act on a specific enzyme or produce its action. First one in which competitive equilibrium. Competitive means equilibrium. Equilibrium is same. Okay, competitive. Such inhibitors increase the Km value, but the Vmax remains unchanged. Let's here see. Km value increase in competitive, and Vmax it's a constant. Which drugs produce act competitively, or which enzyme? First one, drug like physostigmine or neostigmine compete with acetylcholine for cholinesterase. Means in which competitive type two drugs like two or more drugs act on the same receptor. Means both drugs action on a same receptor, they are compete each other. These are the my enzyme, this one is my enzyme, you stop I go, like that. Means two or three drugs act on the same receptor, sorry, same enzyme for its action. Here is seed. Physostigmine, neostigmine compete with acetylcholine for cholinesterase enzyme. Means both drugs are act on cholinesterase. Second, sulfonamides or PABA. PABA means para amino benzic acid. Compete with these sulfonamides compete with PABA for bacterial folate synthesis. Second, allopurinol drug compete with hypoxanthine for xanthine oxidase. Means allopurinol or hypoxanthine act on the same receptor, xanthine oxidase. Second, carbidopa methyl-dopa compete with levodopa for dopa decarboxylase in brain. Second, warfarin or vitamin K synthesizing clotting factors in the liver. Both are same act on a liver like coagulants. Both are coagulants. Second, non-equilibrium type means non-competitive, in which Km value is increased but Vmax is decreased. Such a inhibitors increase the Km value but the Vmax is reduced. Organophosphates react covalently with the esteric site of the enzyme cholinesterase. Methotrexate has 50,000 times higher affinity for DHFR, means dihydrofolate reductase, than the normal substrate of DHFA. Second, non-competitive. In non-competitive, Km value constant and Vmax value decrease. In competitive, what we say, Km value increase but Vmax constant. Here see opposite of that action. In non-competitive, Km value constant but Vmax is a decrease. Second, drugs and competitor inhibitors, non-competitive inhibitors. First one is acetazolamide, non-competitive inhibitor of carbonic anhydrase. You all are know about carbonic anhydrase. So short tricks with carbonic anhydrase inhibitor. All drugs ends with suffix zolamide, acetazolamide, brinzolamide, dorzolamide, all zolamoid act on a carbonic anhydrase inhibitors. Second, aspirin or indomethacin act on a cyclooxygenase, means cyclooxygenase inhibitor. Second, disulfiram inhibit aldehyde dehydrogenase. Nialamide inhibit MAO, means monoamino oxidase. Digoxin or cardiac glycoside inhibit sodium potassium ATPase. Theophylline inhibit phosphodiesterase. Second, profile thiouresyl act on a peroxidase in thyroid, means profile thiouresyl act on a thyroid. Omeprazole inhibit hydrogen potassium ATPase, means in which we say also like that. Proton pump means hydrogen potassium ATPase. Omeprazole or all prozoles, last suffix ends with prazole, inhibit proton pump sodium hydrogen potassium ATPase. So friends, today's video we see what we see topic pharmacodynamics, means how drug act on a body, its action, its side effects, like that. First we see drug change, drug action on body, it's like physical action or chemical action. In chemical, we see competitive inhibitors, non-competitive inhibitors. Competitive means many drugs act on the same receptor. Non-competitive means particular drugs act on a particular enzymes. Like that. First, we you remain one examples of each class, like physical action. Osmotic means mannitol. Adsorptive means charcoal. Here is the examples. It's very important because sometimes directly question asking from like these tables. Radioactivity, chemical action, about that, how chemically neutralize that produce action, or some main enzymes, it's a main topic. Stimulation, only two drugs in stimulation: adrenaline or pyridoxine, and their stimulated enzyme adenylyl cyclase or decarboxylase. So friends, we will meet in the next video with new topic. If you like this video, so please like, share or subscribe to our YouTube channel for daily pharmacy videos, for especially Gpat Sniper videos or Get Life Science videos. Thank you. We will meet in a next video. This topic is this table is so important. Drug and their non-competitive inhibitors. Let's see once again. Acetazolamide inhibit carbonic anhydrase. Aspirin, indomethacin inhibit cyclooxygenase. Disulfiram inhibit aldehyde dehydrogenase. Nialamide inhibit monoamino oxidase. Digoxin inhibit sodium potassium ATPase pump. Theophylline inhibit phosphodiesterase. Propylthiouracil peroxidase in thyroid. Omeprazole inhibit proton pump, means hydrogen potassium ATPase. Proton means hydrogen. Okay, it's simple tricks. So thank you guys for watching this video till the end. We will meet in a next video. Thank you.